Welcome everyone. Thanks for tuning into our webcasts. Today we're presenting on From Cyclones to COVID-19, Yolŋu Perspectives on Disaster Management. My name is Michaela Spencer. I'm a researcher here at the Northern Institute, and I'll be working through a number of slides at the beginning of this presentation and then handing over to a question and answer session from the Yolŋu co-authors of our research work here. So first of all, I would just like to acknowledge the Larrakia custodians of the land where I'm standing at the moment and pay my respects to their elders past and present. I'd also like to acknowledge the Yolŋu people of East Arnhem Land. Many of our researchers have come from these places, these lands, and again, I'd like to pay my respects to elders past and present. Today we're talking about Yolŋu perspectives on disaster management, drawing on two threads of work: previous research around cyclones and current very live responses to COVID-19. This video that you're seeing now is actually a redone version of our initial presentation. We did have some disruptions due to some unfortunate Zoom bombing, so this is a re-recording. In the first instance, we did have the full team present, and I'll introduce them in a moment. But for now, it's just me creating this re-recording, so I apologise if it's not quite as vibrant as the original. So working together on this piece of work, we've had a number of Yolŋu lecturers and researchers who've worked for many years with Charles Darwin University. There's Gawura Wanambi and Joy Bulkanhawuy, who are both senior lecturers in Aboriginal Studies at the College of Indigenous Futures, Arts and Society here at CDU, as well as Rosemary Gundjarranbuy and Dhamarrandji, two very experienced community-based researchers and recipients of the new CDU micro-credentials in community-based research. So it was fantastic to have them involved. They were calling in from Elko Island. Also Yasunori Hayashi, who's the Director of Yolŋu Studies here at CDU, and myself, Michaela Spencer. As I said, the rest of the team will be here to respond to questions at the end. Okay, so first of all, a little bit about our approach. We work with an approach that we call ground up. This very much involves working collaboratively on the ground around a variety of different research questions, usually in remote Aboriginal communities, also sometimes in Darwin and Alice Springs. We develop locally appropriate tools and methods, so rather than a one-size-fits-all approach that we just transport to the places where we work, we're always very careful to develop tools, methods, understandings and practices that are co-designed and appropriate for the people with whom we're working in their particular places. We recognise the sovereignty of traditional owners and take seriously both Indigenous and non-Indigenous knowledge practices in our work. And often this means reassessing some of the assumptions that are brought to the work by the university and funding agencies at the outset. And really we find often people come to work with us because this is what they're looking for, ways of perhaps slightly rethinking or adjusting their perspective on persistent problems within their organisations, so as to improve possibilities for governance, business service delivery and collaborative engagement with Aboriginal communities. So the work that we've done previously that's been associated with disaster management really cropped up around the times that cyclones Nathan and Lamb hit Arnhem Land. These were two cyclones that arrived in very close succession, and we were working with Red Cross at that time. There were two projects that we were involved in. One of these was about the safety of people living in Aboriginal town communities and the long grass in Darwin and Palmerston during cyclones and other emergencies. And then there was also a piece of work that was to do with Indigenous volunteering and disaster management. The Red Cross were very interested at that time to think how could they work better, more collaboratively with Indigenous volunteers in remote communities, recognising that perhaps they needed to adjust some of their thoughts about what volunteering was and could be. And of course, we're now branching into some very recent and active research around COVID-19. And we'll talk a little bit about this later, experiences, perspectives and insights from Yolŋu around the response that's emerged around the virus, and practices around managing the pandemic in remote communities. Okay. So in a way, the cyclone research sort of sets up some of the COVID activities that we're involved in now and introduces some key themes and concepts. I won't go through each of the research projects that we've been involved in around cyclones, but just share with you some of the outcomes and surprising elements that arose in these projects. So when we sat with people in Aboriginal town communities and in the long grass in Darwin and Palmerston, we were in many ways expecting to hear stories about their vulnerability. The Northern Territory Emergency Services had come to us and said, look, we have a whole lot of strategies and policies that are concerned with helping people to remain safe when a cyclone arrives, but we're aware that these strategies have been developed without close consultations with those people that we feel might be most vulnerable in these times. Particularly those living in the long grass. At any point in time, there might be quite a few people from all over the Northern Territory by choice or circumstance living rough in Darwin. So this was part of the idea motivating the research. But what we found when we started talking to people is what they told us about was how they were still very much strongly involved in networks of kinship and care, that family knew where they were, that they were not alone in the long grass, and quite the contrary. That also they had very clear strategies of remaining safe when a cyclone came, the same as people living in town communities such as Bagot, Minmarama, Bunmal Dam, Nucky's Lagoon, Acacia. Everyone explained very clear strategies of knowing when a cyclone was coming and exactly what they would do around getting to a shelter, if that was appropriate at that time. Both in the long grass and town communities, leaders played a clear role in this. Everybody knew who had a leadership role and was happy to look to those during these times. There were also strong networks of communication that involved family coming and finding people. It was also involved perhaps slightly unconventional information sources, such as the bottle shop, people hearing about cyclones and what to do from the bottle shop, the hospital, because a lot of people in the long grass are here because they have family in the hospital, so being able to stream into the hospital and check the TVs there if bad weather was coming was an important communication source. So there were many different ways of remaining connected and remaining aware of what was going on. There was also a lot of trust, awareness and appreciation of existing services offered by the Northern Territory Emergency Services, the Night Patrol and the police. And this trust and appreciation had been established over many years. And if there was any point of vulnerability that we found, it was vulnerability that emerged if the policies around police and emergency services picking people up during cyclone times was to change. So if policies shift more to everybody look after yourself, then services that are oriented around caring for people, helping them to get safely to a shelter might stop. And if there were these shifts that people were not aware of, that's where a vulnerability might arise. So in the long grass, everybody knew there were certain places that you could get to out on a main road or near a school where you're likely to be picked up by the emergency services and helped to a shelter. That the shelters were likely to be open in time for you to get there. So there are a few key points like this that emerged as quite important when keeping everybody safe. So as I mentioned, we also did a bit of work around Indigenous volunteering in remote communities. In the community of Gawura in Elcho Island, we sat and talked to people about volunteering before, during and after emergencies. The cyclones were very, very fresh in everybody's mind. That through these processes, they had a lot of understandings of the value of volunteering and volunteers during emergency events. At the same time, as we started to talk to people about volunteering and caring for family in cyclones or other emergency times, what everybody started to say was that volunteering is something that Yolŋu do all of the time. This is how we connect with family, kin and our places and homelands. These are practices of care that we're always involved in. This is about older people supporting young people to grow up well, and that volunteering is something that we are always doing. However, that also working together beyond these established networks of kin, so working across Yolŋu communities and engaging with service providers, emergency organisation, actually helps create strong community in times of emergency. And the Yolŋu co-researchers that we were working with had a lot to say about exactly how this collaboration, how this working together beyond networks of kin could be done appropriately and well. And this really oriented around a term that Yolŋu use called Rau Manapanmir. This is a term that is used for many different things, and it actually originates in a hunting context, so it offers a hunting metaphor. I don't mean to generalize the use of this term to other research contexts, but here, talking about volunteering and cyclones, it emerges a very important concept. So Rau Manapanmir is this concept used to describe Yolŋu ways of working together. And Rau is used to describe particular abilities of an individual to procure food through hunting, such as catching turtles, crabs, finding yams, wallabies, etc. Manapan is a verb which means to join or place together, and miri is a suffix which makes this verb reflexive. So we do it for each other, we do it together. And in the context of volunteering for disaster management, really this meant very specific things about good and appropriate ways of working together, so that each person is different and has their own talents and contribution. So not everybody needs to know the same thing as everybody else. We each bring our own expertise, and that is what is important and valuable. That successful activities, for example, hunting or volunteering, need to be properly negotiated and undertaken as a group working together. So how do these expertises come together? How do they work well together, and how to negotiate that? Also recognising that the authority of people who know and own the land needs to be central to negotiations around how we go on together around a particular activity. And so really this idea, this complex idea of Rau Manapanmir seemed to emerge and be taken up by the Red Cross as something quite important within understanding how to do volunteering work in remote communities, recognising that it wasn't just there wasn't just a vulnerability in the community that could be solved by bringing in people from outside. There wasn't just strength within the community that could be supported, but really it's in the means by which everybody came together to work well around particular issues or emergencies that resilience could be constituted. And I think that they're still working with this idea at the moment. So that was a little bit of a brief overview of some of the ground up research around disaster management that we've engaged in before and some of the key ideas that started to emerge. Obviously, the process of beginning research around COVID-19 needed to proceed quite differently. The actions of travelling to communities and visiting people in their homes is not at all possible during lockdown times. And so we needed to develop ways of working together online. At the same time, these ways of working still needed to be robust. So still needed to enable Yolŋu to speak in correct ways about their experiences in their places as part of a way of sharing and creating knowledge together. So just because we're online doesn't suddenly mean that everybody can speak for every place. Everyone still needs to be situated where they are and speak appropriately from their position and through their identity as a particular Yolŋu person. So to talk about COVID-19 in remote communities, we've needed to develop a team that's based both in Darwin and Gundjarranbuy. We connected on Zoom, and those that had computers came in on the video. You can see here on the top of the screen pictures of Gawura and Joy, top left there. They work at CDU and came in online on the computer using Zoom with their headsets. Next to them are both Nori and myself, again in our particular offices at CDU, all separated throughout the campus. But what Gawura and Joy said very early on is that, look, if we're going to talk about remote communities, we need to speak with people who are there. So down on the bottom set of photos, we have here Stephen Dhamarrandji and Rosemary Gundjarranbuy. As I mentioned before, they're experienced researchers based in Gundjarranbuy, where we work quite a lot. And so they joined us on the phone. They didn't have a computer that they could look at as easily, but they called into our Zoom conversations and were able to take part in the discussions and negotiations of what is important information to share at this time. And you can see a bit of a map there that we were connecting between Darwin and Gundjarranbuy, speaking in Yolŋu. So all of these conversations were conducted in Yolŋu and were translated and transcribed. And in the sections that follow, I'll actually play some of the audio snippets of these conversations showing what each of the researchers said. And this is pitched towards different audiences, so I will play some of the Yolŋu and then also there's some translation. But we'll get there in a minute. First of all, I just wanted to mention what was very key and crucial for this team was a sense that there's been a huge proliferation of mainstream biomedical stories around COVID-19 emerging in remote communities. So this energy around keeping everybody safe has been quite amazing and overwhelming. So there's a picture there of the map. This is the bioregion of East Arnhem Land. So the Northern Territory's borders are closed, but so are the borders of this bioregion. Yolŋu living in this area are able to travel to different communities, but as soon as they leave this region, if they were to return, they would have to quarantine for 2 weeks when coming back. So it's a kind of quarantine area within a quarantine area in the Northern Territory. There's also been a huge emphasis in creating a lot of education materials that talk about germ theory in Indigenous languages. At the top right corner there, this is a video created by the NLC talking about coronavirus in Yolŋu. There's been government brochures and pamphlets talking about keep our mob safe, wash our hands, as well as a lot of local videos made about social distancing. How should everybody stay apart from each other? Remain separate, don't come into close contact even when you're in remote communities. And there was a sense amongst the Yolŋu team and in our discussions together that these are a very mainstream story. This is an important story. It's geared towards keeping everybody safe, but it also embeds particular assumptions. And there are actually other stories that it's quite important to be hearing at this time. So whilst acknowledging the value of the biomedical story, we also want to suggest that this is a particular take and also share with you a few other stories that are important. As I said, we recorded these in Yolŋu and have created some English translations. I'll play some of the Yolŋu, then I'll read others. If you only speak English, bear with me and please read along. So here first we have Gawura, and he is talking about some of the feelings amongst Yolŋu as this virus arrived. And he says that Balanda are panicking because they don't realise we have our own ways of doing things properly.
Yo balanda malaka yang balangunya ngoy gare ngoy bet petun walka ngoy gare walka lembro nyolka nama ka kanjar walka na marki yang balayan kanjar wala ngam marki dal meter kanjar nguna walka marki job lel ka na malany nakun wap mambuko nganyan nakun ngune jora dolet pepa ngula na ngata walka buko nganyolang ko wap marka waltu nena ngonge marka walta yaka buko ngere puro job makal na maka ngune ngama ba ka makol ka berkayon nakun repon yan be ngalam rong wala lang barare yan be nap lemurong kalto Yolŋu alkare de pale abolo lemurong alka na manakun ngalemoro yende nakun ya ko mak high risk mo mak ngalemoro karamat nakun naong rebalnya dele lam to body and toilet maram o ngalemoro vulnerable ya ko ngune wala ka vulnerable ya kalakam tunga walal ngune ngalemoro ngunja ro ngune digital ngora be ngor lengo pingu lemurong ngayang dalian kang ora bayang lemurong pitay ngayang yalgetin balanya na kunrom go na bay primalibundi an lemurong ko lemurong na habak manayan wala liatu kan wala lemurong del kurorio na kun ngoran ngay kan ni rom ngalemurong yoyur na ngay bunan nguni dol muna ngay rom ngay ngan ngoran yan gazol brak ngoran ga kaman mak ngay dollar punya ko ne balanya ngalemurong dalian rom gamal tunel mo jogo ya ko gamal melkom ngay kadoli na kuno rebel limurong leadership yutta ngalemurong tiyak pala maritnya do na ko na kon balanda rom go facing balanya.
Yes, so following this law shows our original leadership. He was also saying, how do you individually think about the threat of the virus? So my response was, I have to look after the family first rather than myself. Family is the first priority. So we need to keep looking after our family, our clan groups, keeping them close to each other. Protecting our own family or clan groups, and other Yolŋu will do the same for their families. But on the other side, the Balanda law is preventing this from happening. You have to sit apart from each other. That's what they say. That's their policy. And also that we already have our own clan leaders here, Gawura and Jedike. Gawura says.
Yo ga ngunay del kuro ngalam rong marki ngunay na ngunay wa mala ko menete mala ngateleng oy nila nawe melaka nawe galaka nawe nyeripa nawe ngateleng del kuro ngalang ka ngunay del kuro majina liya to kar mala ngunay roma mama na mala nila marki na kwal to rom mama dol rom gor bel makoro na koro una kurmula nila marki ngunay miyal kabala nyalengo oro ngomiyal para nyalengo ka di pala ngay itong ngayon balanda yatarangan di kung mardel koror na purong majindan na muruki jagaw na kundiamaw ka darangan do balay ka mardarangan kanama ka uri po yung muna babi wang muruka yurtaw Yolŋu ngay ito nama talay muna yung del koror nalkar kandaran ka duwal balabadak tarayan ka dalian unangar balanya yo balanda malaka yang
Okay, and then here, Joy and Gundjarranbuy are also sharing their stories. Rosemary Gundjarranbuy says, the message we've received is sickness is coming.
Kunyangay na kondo duwali na kondo murunga dikan wanga kam riri kadwa barko itara na deka riri kadwa marki nindo ka family barko nina ka wanga nito ka barko unin na kondo wala lang yang naoy ka bala na kondo lang family to family jangan daw ja na kono na unja gapte bacha na kono wanga ngol bala na kono ni harap to kanina do ay mereng wa jamar kole uindo na kono ba ngol brong bak mala ya pala nya.
And then Joy points to the issue that the COVID-19 law is made by the ministers and the government.
Kaya mada mari maji romgo biliwal kadwali bichandi na mawagal balanda walal kadia ki romgo COVID-19 ko ngai ka ngura dwali rom uniwal ka jali nayo limuronga ministers to mala government wal jama limurya to nalchana limurto dwali baikara mai rom dwali ngai ngura ngai limurong rom yurdi kai limurna to Yolŋu na maram yual komanian nalchana ngalito lichalango jangali pa family darai yual komanian.
And Joy also says that some of the young people are disbelieving. She says it's up to us old people to demonstrate to them the strong, strong, strong law, showing those little children that are running around. For example, we're in Darwin and our children are all in the different communities. They're all independent, but we're able to contact them. We always look around for them, make sure they're all right. So that's the sort of the sharing and caring practice we need to maintain strongly. This is how senior people act. Even though we're at work, we're always busy with looking after our families. These new arrangements must never interfere with our ancestral law, including how we are living. So we need to work out a strategy so those traditional practices don't get obscured or disappear. Even in COVID times, is a suggestion here. The emergency of the pandemic does not exclude the need to maintain traditional practices and ancestral. So here a little bit of commentary or interpretation of what these researchers, elders have been saying. So there's the idea that Balanda don't understand Yolŋu law and governance. or if Balanda don't understand Yolŋu law and governance, that they panic when a difficult situation comes along. So it's very easy to actually forget or fail to see some of the resilience and the strength that is already embedded in communities and practices of kinship. Then also what counts as an appropriate unit or a body to be cared for is different for Yolŋu and biomedical science. So for Yolŋu to care for your body during pandemic times, it means caring for your family and clan. It means caring for your homelands. This is the Yolŋu body that needs to be cared for and is likely to be damaged and become sick if you don't do this work. So this is quite a different body to an individual human person, a body that's considered as just a single thing that might contract a disease or be infected by germs. So it's a much more collectively organised body that is just as important and absolutely needs to be cared for and kept safe. Different understandings of the body actually imply different practices of care, and that these practices need to be negotiated in place so that the way that you care for a body that's constituted through kinship, that involves people and places, those practices are very different for how you might care for just an individual biomedical body. But the way to negotiate and bring these practices together is through work together in place. And that there's a caution here that as organisations bypass elders in addressing community problems, young people are beginning to look to one biomedical body and practices of care. So they're forgetting the other Yolŋu body that is also present and is also important to look after. So there's a danger here of a hollowing out of elder authority that comes along with observing only one body that needs to be kept safe. And then there's a few more comments from the team. These are more to do with the way that messages about COVID-19 are arriving in communities. Stephen talks about how the story coming from government is coming from government, but it gets stuck.
Government kong dela banjelegat tunja yang ora datang oleh dawat tunja yo marto ni balan dan malaklanya mereka yo kan lakon ay ngi daw balay sawadon tiawgal ko dol bala malali da malalim rongadina.
And Rosemary talks about how the story comes from the government to the Shire and from the Shire to the clinic. Then the clinic gives everyone a bar of soap with no story. This is what makes the senior people afraid. No one has come to them to tell them the story first. They're the ones that should share it with their clan groups and coordinate everyone. And perhaps the biomedical story is being shared, but not necessarily a strong ancestral story of how to work together in this time. And then Rosemary talks about how we've already got the Makaduni, a Yolŋu governance group.
Kaya ngali nyipikan kwa ngana mendual nali akpalang nyalang dari Makaduni na ujual dua dal kadaga jiri kadi albanji jadi ay marka bal na probalangi oversee nguni bal na kunji dawo marici bingo syayangul ngai to kabala Europe malam kalkiri ngai to kaga ngai to nguni le mala jari yuna ngai dokar manmak ayun na malangun balang wangi ba purungul
So it's a Makaduni that can let all the clan groups know. Bapru, clan group. And then here, finally, Gawura talks about both some negative and positive ways that the story can be told to Yolŋu people. First of all, he talks about some of his experience in Gawura, his home community.
Ngurong yan ko yang abican berkayan da ko yang arang na community yang ada berkayan bijan wana kingula dao dia ko marci balai ngula betul dao mirwal ka community nguna yolong na da purut mirwal nguna gulun ngula ke bala amart mamda apa yang betul dao mirwal malaki nene ngai dao nyole bunna balai ka balayan beli mangal naukal al center tala karir pumen ngai daw buna kalur kun nola penin balande wal kawne rata mai daw bangon ngai community ya ngako ngai daw bawang kai nang liurung ngai maram balai tala karir pumen wal bian dia magawala pigo ngai mer amar andang ne balangara wangan muroki nakon yaka ngayon doon pa nakon wakayama mangkat na yolong rale meriam balay meeting lo kangay ngayon na yolong jaba ang grupo daw balay ko manito ja kuruto mera balang araw na may makon yaon ko yol merki manapan mera kajaman wal kanya meeting wal jama walang wal ne meeting wal kanya ral manapan mera jama jangon bala tahu tu oleh grupo nga yako meriam na mera wal ka jar magan na mera malaya ko nyol ne meeting ne leke balay kamal darangan wala nyol miki balay jamal ja bayang wal kang langayang web breaking wala ka dawon kama ngayang dap mamol ka mari dap mamalina malindaw wal ka kama ngoni kaman mak tangay jangon bala balanya.
So it can be different if you rely or ask one Yolŋu person to share the story or one elder to authorize the way the story is coming into a community. But really things can work better if there's more Yolŋu involved and everybody works collectively. Gawura then went on to say that, for example, in Gawura, what could have happened or what did end up happening is that the Dhamarrandji Trust, the TO group, invited 3 people, Gondal 3 people, the Art Centre 3 people, the Ranger Program 3, and so on to come up to a total of 12 or 14 Yolŋu. This way everybody would be involved. And then in Gawura, this was done. And this group was called Jama Ganamirmala. After this group had their first meeting, they went to 50 houses doing house-to-house visits, telling the deeper truth of the situation. That's a good example of Yolŋu leadership. And Rao Manapanyira woi dur. So coming back to this idea of Rao Manapanyir, working together in the right way. Okay, so here's some commentary on these points made by the team. So working with clan leaders and identified leadership groups can actually help to strengthen Yolŋu authority at the same time as increasing collective capacity. So this doesn't in any way injure the possibility of sharing a government story or a biomedical story about health, but actually supports this story to be shared in ways that can be heard and ways that recognise and strengthen Yolŋu authority. But there are also ways to co-design workable solutions which take seriously Yolŋu and Balanda imperatives. And I think part of this is also recognising the assumptions that are brought by a Balanda understanding of the story. And these assumptions can be very difficult to see. There's no critique of these assumptions, but they are different to the assumptions working for Yolŋu. And it's this difference that we're trying to support people to work across. So working together in the right way will assist communication, coordination and safety on the ground. So again, it's best to both work together with our differences. So to conclude, before I hand over to the Q&A session, this is some early research, some beginning discussions, and we will probably continue on in this vein. The COVID crisis is itself shifting and changing all of the time. But the Yolŋu team felt there were some very important stories to share at this time that were not really being heard or understood within mainstream understandings of the disease. So these stories talked more about how, so the stories that are already emerging in communities tend to talk more about how to educate Aboriginal people in remote communities about germs and hygiene and how to manage behaviour around social distancing. So these tend to fall into a kind of deficit model, assuming people don't know how to organise or how to understand germ theory and biomedical science. Of course, these are important, but there's also other concerns and opportunities for collaborative practice that are out there. So to summarise, ways to keep the Yolŋu body strong is following both laws, Yolŋu law and Balanda law, not only one of these laws alone. Processes for doing biomedical safety are important, but so is the care of the Yolŋu body as a whole, including country through networks of kinship. And this brings in questions of homelands that will be talked about also in the Q&A session. This includes respecting the awareness that's already there in communities and approaching Yolŋu leaders when first bringing stories of new diseases, and perhaps recognising that leadership in communities is complex. Communities themselves are an imposed entity. They're brought by the missions, so it can be confusing to find appropriate Yolŋu leadership, but it's always possible. When young people only listen to the biomedical law and Balanda understandings, it can actually make it harder for Yolŋu elders to maintain their strong authorities. So Yolŋu elders, as Joy said, are always doing this work, always doing the work of keeping kin and family together, of keeping connections between people and places. When the young ones think they know everything about the law, about Ballinger law, about remaining safe during COVID, this can actually make it harder for the elders to do this other work. And then finally, that resilience and preparedness emerge as an outcome of doing our differences together. This was there in the volunteering research, it's coming through again in the COVID work. So it's working together with, through and amidst our differences that actually we can constitute a strong response to disease. So thank you very much. Thank you for listening. We will now connect to this video the Q&A session that we had during our webcast where the Yolŋu team were present. People actually sent in questions on the Zoom chat, and so they're the questions that are being responded to. So please stay around for that. During the Q&A, we were also joined by a very special guest, Gawura, who's a senior Lea Dalamere man living in Yuri, Milingimbi, and also an MLA in the Northern Territory Parliament. So he has a few things to say during the Q&A session. Otherwise, that's all from me. Thank you very much.
Gawura, Dhamarrandji, did you want to start us off with extra comments that you might have had about thoughts around what moving to homelands, how that's important in the time of the pandemic?
Okay, then I guess I'll try my best here. There's about 29 participants that are listening. I mean, we haven't been sort of talking much about this, but we was before. But for this year, we haven't. So as I said, I'll try my best to sort of how it is in regards to the COVID-19 or this coronavirus or the pandemic word and that is happening. This coronavirus, the thoughts, the idea or the thoughts or the plan or the feeling when Kalikali Michaela said about the homelands, the thoughts of the homelands. Homelands, what we call our own, with each Yolŋu got our own estates. And we call that homelands where those areas house of who we are, where we come from, really. Every one of us here, four of us, there is, as you can see, for Yolŋu people, we've got our own homelands, home clan groups, and our own homelands, our own estates that we where we belong to, where all our everything is. Anyway, talking about the homeland, thoughts about the homelands, it's the homelands itself house everything that has been there from ever since when that piece of land was created. It holds everything where you can find, where you are free, where you won't get sick, where you can be healed. The place itself will heal you. If we are in the area of getting all this stress, getting sick of whatever, homeland is the best place to be, where it's free, where that homeland, piece of land, everything in there that you can see, hear, feel, eat, drink will heal you. Even there are stories in there. Even the spirits of our ancestral beings, our ancestors, our forefathers are there, that we can feel and get healing. Now, there's another thought or area where we as a Yolŋu were thinking of in regards to just to get away from this pandemic or this COVID-19 story or the sickness it has helped. Move back to the homelands and just be free and just listen to the birds or to the waves, sound of the waves, instead of just hearing this pandemic story all the time, every day.
Gawura, we have another question here that maybe relates sort of to some of what you've said, and Nori is here. So I will open this out to everyone. Thank you for what you've said so far. The question about how does some of what has been said here apply to Indigenous people that are not necessarily so closely connected to communities or living in urban areas? So there might be an interesting response to that one, and whether it's possible to talk about that. Yeah.
So do they know that question, or?
So this is the question to the team. It's on the chat.
On the chat. Yo, mình này mà ngã mà hoặc commander. Yo, mình number iral kangol o community ngol yuro nar jamara ga dia na pona India ngol ja Yolŋu na pona Darwin Palmerston Catering ngol India ngol ja na jamara te ga mako jaga na wala bili ngol iral kangol na pona ningawangan manyak ne wangay nga na mulka kom numalan ka ngate darwa ka Roma ngora ngonere yuro narite na pona doalangoy Darwin puy na pona pam sa India wanga punya narite wala taka na daray wala
Kali nama tujel de pongri uj par balay wala nama de pongri na kumukul maje o kali ni kalkingor I got answer na kundi bali answer goli question ebian. It's fairly different. We know very, very different to Lengala Nakun. Nabala Nakun now in the community. Mayakan, the Pongo answer.
The only Nakun community is different.
So the life in the community is different from the living in the big city. Yeah.
You knowing eating a jama. Then your community, especially in a city like here in Darwin.
It's a big job and a big Jama with its job to do properly in a big city like Darwin.
Because
in a big city, the senior people live separate, not live together as in a community.
Muni ngai jambat Yolŋu ngai marikin sulu nakon tuala carumgur margetinya korumgur nakjandu zarai Yolŋu walalang alung maram paguru pandau.
So the people who knows how to look after the people and they share the story and looking after each other.
Paguri pungana punguli kalanya nakon ngana punguli ngana punguli bising. Muni ngana prung dal na military ripu na to ripu ngana prunguli ngana prung work na gana tam muni work muni ngana prunguli ka ubur na palanjaw na ka larum Yolŋu walang yurbulo ngana prunguli thinking Yolŋu buk makana prunga ni na dial Darwin munawal kanina barko waj Uripu kanina wangangol, uripu kanina ngona bala wakri yun walaka, uripu malaka wakri yun rangi ko, uripu walaka wakri yun ngona bala mulmuk ko, uripu walaka wakri yun Yakangaramari Ripunga Prungli Malakmamalan Ripun Baingon.
It is such a big effort and it requires a lot of sweat to find the right people, to find the right family, because they're maybe in the water fishing, they're in the bush, they're at home. So it's a hard work to find the family. Good to me, find in people in Darwin.
Yo, mulinga na prungol laron malanga, make sure they safe. Mula nangol malangol, even dipungol, readingol. Paris muni kadwal may kidiyang bala. Pingulinga na prungolingon ni makarna manguni mala riri mala. Palaron malang. Ka make sure malak mga walay. Kanirpan walay. Marawal to kanina. Yakawal to mara mula na riri mala. Wipwali wal.
Having said that though, even though Darwin is a big city and difficult to find people, but we're trying and we are looking after them very carefully. We are trying to connect with them, even though this is a big city of Darwin. So you're not practicing the care as you do back in a community and a homeland. But it requires much more work and sweat.
Yo, pala niya nga ito already. Yakan na mire. Yakam, it is too easy. Need to go through this. Yakka. Puna purung mala, pala niya na kung nga na pumara nga na palmir nga tilimutan na mala. Kaya nga na pruka maram. Tiyan niya, hindi mo niya si Chingol. Pala niya hindi kama nga na purung.
So people say it's easy to follow the biomedical story from the many places, but for elders like born a very very long time ago, they are born. Sometimes it's hard for them to follow those information coming up from those health services or those institutions.
Yeah, although lagi na medical side. You take only you are buying a water bicure. Tianja, fix it in there. Unawal ang ginalwala liya ini nakangayang. Kangan pong birkay yun, printed to bring them along. Make sure they are safe.
So like elders, like it's hard. It is hard and challenging to follow. You'll try hard to make sure families and young people, elders, they're all safe.
Thank you, Yapa. So we've been told that Yolŋu Gawura is now on the phone as well. So welcome. He is joining us here today, not so much as a MLA, but as a senior Leader man, and will no doubt have some things to say. We now have another question here. Do we know if relationships with communities have been damaged due to this approach? And is there a loss of some faith in the government and its leaders at the moment? So in response to the pandemic right now.
Nakuha niya conversation last week or 2 weeks ago na mga namin really na daw yan na Gundjarranbuy daw nga baranda mo nga bunna community ngor kama ko diang daw ita kama ko Yolŋu nga Dhamarrandji ka daw nga jarpitri ka una irar ka ngor community ngor kama ko ngorngi daw ita kama ko bakmara mako room o mako jarpik room na pa area ngor ka living na pa housing ngor so ngoni daw ita ka nawi yai kuru kumakoni wala na kung government o mga health providers na kung hospital. Bili at the moment ang daw na kung 2 weeks ago na puro na ngati kamit kawawa na puro mga namin kung daw na kung ba puro side ng gali kurunja kung daw ito kapag yung room yuristri yung ngay tam numaranging room ngay tam barak yung ni message na kung na kurkuman na kung wala government nan o provided. Nandiyan naman po yan.
Wana numato dele nyola akamu pangayal lam pangula malimurambang di palera kawangan wana kami phone ko
mati aize
balem ko kawangan
ningi
Nah, wana namin maka.
Di pala kawangan.
Yo, I had it on mute more. Sorry. Now, kung nga tulong aran nung now tao question jam pangade.
Yo.
Yo, I think it's not so much about now in government, the authorities malanakon health more now or Yolŋu leaders in community or now mala. It was really a waste of time. Racing le moro. Reading money. If my Bulgarian so there was Tarawa issues came through in a short period of time. Nakon palanya. Kaya Yolŋu are confused even right up to now. That in the end, when in few months time, people will be still wondering what was that all about. And all we'll know is that everybody is safe, especially community. But I'm worried about restrictions of now funeral that was 10 to 10 lil. That was a law that came through. And we've got to be careful. Some restrictions are lifted by doctors, government areas, but the law only can still cause some fines or people going to prison. And surely that's going to be an issue of now. That's why you're more confused. I was listening to Gurung, Joy, some Yolŋu or Darawa Yolŋu are in Darwin. They don't know what to do. Whether they need to find a way going back home, not get into trouble, go why can ultimately and there are ways when the people know when you can tukar na kundara through Larake Lodge School, no, Larake Nation go travel to country, the permit and then they get sent somewhere else to be quarantined through territory families. And on the other hand, there's NLC offering now passes for people to go through the communities. Where do people really go? What does this? If I go to Larkia Nation, how far will they send me home, or when? How long will I wait? And then people are saying, come to NLC, get this pass, and you can go through home. Balakabawa, and everything. Pangadi. Tumbalion.
Yep.
Laromanga. And even though we are going through, those of us who have been following, even in areas like myself, as a member of parliament, I've been following it, but trying to translate it now with Yolŋu. And soon as they start to pick up Tao, they're still learning what is happening, and then another law comes through. Another law comes through. Exactly like what Gurung was saying. So in the end, I thought reading Jurksuna and here in the communities, Tarawa Dhamarrandji Kandial Yolŋu. I've been a long Christian for a long time, since 1976 to baptism Marangal, the confirmation. Again, we got to take care of. Yo, take care of me too. But pulungai thinking of we need to walk to serve Yolŋu at the community for God konan ngojamo. Epian. Yan nakalan nilakam. Because people can begin napper in the back by God to now go and then they forget about it and do something else.
Yeah, lots of stories around natin. Nani the God Pridao, Gawura Pridao.
Yeah.
There are lots of stories around. Yeah. Yes, so they only take lots and lots of different stories and also biomedical stories. And yes, I think that's true, Nati.
Yo, that's one line. One line really. One line if I can adela mamdal bala. One line really. We can get away in the equator area. It's too hot for virus to come here. Yang I already thinking. Again.
Sometimes the Yolŋu think that the northern maybe in the East Arnhem it's very hot, the temperature. That's why the temperature or heat kills the virus. That's why some people, Yolŋu, and also the story around the God. So it's not really take just one story as a truth. So I think that what my grandfather says, Yolŋu, lots and lots of stories around. So Yolŋu are taking as stories, as a big collective stories, strengthen the life of the Yolŋu, I think. Is that what you mean, Nati? Sorry if I interpret you wrong.
Yeah, totally we in this other now, prediction balanyam. The Sarawa Maringage Yolŋu, Maringage, people saying brave now balanyam. Yolŋu, we're not worried about it. I don't care what that really is. No, they're only thinking about themselves. I'm a Maringage. I'm a now Yolŋu. They're spying about it here. It will never come. That is not helping Yolŋu. That's what I have come through. And Yolŋu have given hope to people who are confused. Well, they given hope and said, we'll just sit around and wait and see what happens. Because Sarawak feeds are coming through. Wanganja through social media, the other one, Wanganja through the real news. Where do people listen to? Government now, Kodao, NT News, federal news, go now or through social media. People are confused. Sorry, I went going on.
Yeah, confused, but also take the story as the yes. I think what you do is a Facebook or maybe private talk and group discussion that will be sorry, we have many questions.
Yo, just a quick one. Just a quick one. Yan Ripun Balay now referring to that question below. Just a quick one. Yes, it is sort of would affect our way of living, our laws. Yes, and it is affecting and giving these confusions. Ako nga kadwali ngay kan ngulong yolong ilakang ali confusing ga bawa ga yang balayo now we are wondering na you are
like what now we
said before you balay bili question ng ni now na puro ngay ka rom ya malay marag mak dan chantoraya ko amen.
The lots of information that you don't believe.
Nakunturo nga alam na puto Bill Maram yapian o goari na puto Bill Maram kabalay turong ningol.
So should the Yolŋu change their ways of living for a short time, or we have to change our ways of living permanently?
You're just by saying yes to that question. Yes, it does. Yang balangay kaligay now by the sound of it, by the look of it, if it is affecting some areas of our what has been there for us Yolŋu until na kunya. just to sort of answer that question, don't you? Balay rungin mam first question ululok mulia. Ada kung menjuali nori. Balay kung yung questioning yo.
Yep. Thank you, Ngati. So, sorry, mate.
On the other hand, dia kau ni ngulung kan yung lakang ngal nakun don dia bala nakun ngalem mar dum bal una dia uni nol nakan lakang ngal dia ngol na bala lem rungal.
Yes, so it is true that lots of information coming to the community, and it caused a bit of some confusion in the community, which is true. So we have other questions.
Yeah. So there is a question about how everything is moving online. And we've been talking a little bit about the social media and the confusion. There's a question about, is it hard for Yolŋu to care for their family online? And related, there's an app that's coming out about COVID-19, and are you aware of that app? And is it being explained to them what will happen with their data? And is it clear what that app will involve? We can go to the first one first.
Yeah, like last month, mako donje CDU ribbon na ngor jiro na jama wa ngor ka meeting ngor na ma online kore na perumangan na mere ka na ngoni yoro ngono na mako community ngor ka ira ka ngor ka do da wi ngor ja online pe ngone live jangoni nanten namal marama manma kuni tukar online perumangan na mere na family group miriwal o marga nga dal namalango.
Bye, man. Ngara de pungor. Yeah. De pungor. You know, I only heard about this yesterday. I think that's going to be another confusion for Yolŋu Tarwaja. The online banking, online now we telecast Wipu Malaga, finding Wipu apps that people join into social media, Wipu Malaga. That's just going to be another app that comes into people like a social media, which is much more helpful, but that was still Yolŋu to do but nakun.
A lot of people
I will find it a little bit hard too.
Yes, so Yolŋu often talk over the phone, and maybe a lot of Yolŋu know much more about smartphone better than me. I put on a live stream on Facebook. But still, like in this kind of COVID-19 situation, the looking after family through the phone, maybe using online tools, is that still?
Mada, knowing I do aligamoro. Bali online lakranya mirdao, it's pretty hard. Pulimurong Yolŋu ja. Yeah. Ya kagulyo na pala niyang ordi romo. Kanjali murja gulyo. Kurang kan milimurkan laninan. Awangan namin. Some of the things kali mukado ali practice muli. Imurja Yolŋu ja. Especially when most of the people are running around, look around for their family, even phone ko likawanga instead of app ko kawanga uniyaka manmak. Because think about young people na mulukor. Nagkanwal tong ni message maram galimurong kung paingo. You need to go face to face. Yo. Kapala niya. Kamu nali murung malah urung limurung tukar ngaidal tualidi. Kerjaan itu uang through Facebook or app or.
Yeah. So for the younger people, this online life sounds more familiar and maybe easier than the Yolŋu elders. But Yolŋu elders still trying to engage with younger people and try to look after them. So yes, so I understand. So it's hard for example. Joy, it's hard for you to look after young people, like people running around or people walking around in town, but still you're trying to get them and try to look after them, and also people in the community too, because I often hear your phones ringing all the time from the community to get some help from you, and also people from Dhamarrandji as well.
Yeah, it's also very difficult for the remote communities. Well, centering, closing up, and whatever the elderly people that are here, which they are finding that one too difficult. Not in the in remote communities, when I are finding the difficulties very hard. Maybe in Darwin or some cities now like that easy, like when you're doing it on online now on services, but for some people here, speaking on behalf of the remote communities, it is very difficult for this kind of jama. So not just support, yeah.
So
Because
how do we support each other?
Yeah, because centering closing up, and you have to do it all online. So what about the people who's got buying on way? Now when you are only Europe, centering
my goal.
My God, it's too difficult for some of us that is in the community level.
So that's where, so as going back to Joy's story, the young people might be able to help if they're familiar with those online environment. That's a new sort of ongoing the ways of looking after. Yeah.
You like through these services, Mala, like online going again, like the one that you told Rosemary recently. There are smart young people there, out there, and ultimately online work. But the problem is, senior people. It's pretty hard sometimes to go around and bring the young ones back to help us.
Or give them more training to do so they can help us.
Well, most of the young children back there in the community, elsewhere, they are very smart democratically. Online.
Smart children.
Mala services can happen, the banks mala, centering, ulana mala, important mala, mala,
so young people, they know the services provided by the non-Indigenous service providers, the government, Centrelink, the bank. Yeah. So that's what we're talking about, the emerging sort of care. So because this situation, because online environment, so we start thinking about the young people. They've got smart skills. They're very jumbo. They know what to do. That's one of the ways they can look after elders, and also elder, as Marcos, as you said, elder trying to lot of sweat and effort, but try to help young people as well, even in the big city.
Yeah. In both ways.
Both ways.
Kali karena jangan itu ni gua banyak orang yang yakan mai gapo marangi ka banyak yang gulung na kunya ko Centrelink to use that my gap. No jangan itu ni gua
Muni ngarakadon jalakaram.
Jadi kita nama
If I'm the mother or grandmother, I will ask my grandson or granddaughter or my daughter or son to sit with me and go through with me. Because they are more smarter than me. Senior people, yan nga to jamar kuling. Marichi ka nini ngarakal. Ato wala ko jama milko ngarakal. Palanya.
So our the responsibility is to actually ask them to sit down with elders so they can teach elders. So that's what you said, like helping each other. Manimak.
Yo, di pale, ngarak mo di pungol jabala di pale. Ja.
Na koro, kale.
Ya ka book makda ka nga.
Ko.
Ya mo balay di question dual bala nanu kung muna ngaong.
Na.
Balay ngunori ngarak mo di pungol jangai kumurudal ngay online ja. Online.
So you find the online environment hard.
Yol ngwal jangai yol kumrudal online ko beli ya ka ngana purung dole mulkro dole. Yala na pujmekian mula jaga kuro kabamara kuro dole jama amangete na putu dia ke ka karorom ko ana putu online Mampu main aprung jo manufacturing online na Wanambi kamur ngur pirka miring kana ingana puro pimbayango bayango na prung inawi ngori na kun bilingai dole mulkuro. Boy.
So online ways of working, living originally is not part of the Yolŋu ways of living traditionally. But I think I think you think so now changing your ways of working, ways of living for the last 3 weeks because you are one of the first ones from CDU to start Indigenous researchers start working from home, and you're doing so well, I think.
Yaka book mak to be honest yaka meriti karar kung no pengon bodak jarpian ngan aplikum rodal tengay event.
Yes, it's still hard for you, but that's where we're helping each other as well. We're trying to, and different changes.
Hindi kalmongal nga rado ya ko ang hindi kalmongal an sa balay question ngana purong Yolŋu molko ngayon yaka ngana purong.
It's foreign to Yolŋu people. The online environment is foreign to Yolŋu people.
By the computer or by the app, Kurmuna phone, Gurmuna, the Jamar Kulit Malangalam, Dhamarrandji media, Alimurjamar or Malador, buying Alamur or Palmer or Mulimarkin, a Tilbora Kujama, near Marangi, at the Akontokarpoli Marikiganole.
Yep. So the maybe new online environment is more for young children and not really for elders. But as Wako says, the young children they can teach elders or not teach, but show elders, sit together with elders to run manapamiri.
We have other questions, but unfortunately we're going to have to call it a close. Some of these questions are very large and will take a very long time to answer. So thank you so much, everyone, for all of your questions and your input. Thank you so much to the team for all of the work that you have put into this. Thank you, Yolŋu, for joining us today. It seems like maybe only the beginning of more of this kind of work together. So we'll draw it to a close. And I think this webcast series will probably continue, so we'll keep you posted. Thank you very much.